You've probably never given it much thought, but believe it or not, the question, should you wet your toothbrush bristles before brushing your teeth, is one that divides people, even the experts. Some say wetting the bristles is a must while others go straight in dry, but is there any science to either approach? The short answer is it doesn't matter and is ultimately personal preference. It's better to be worrying about your brushing technique, as this has a proven and noticeable impact on your oral health, unlike toothbrush wetting. But for the sake of interest, let's dig into the details a bit more. Not to confuse the argument even further, but the main debate is wet or dry bristles. But should wet be the preference, should we consider if they are made wet before or after paste is applied? For the record, I wet my bristles and generally do so before applying the paste, but sometimes I do it after. The case for wetting your bristles. The main reasons many give for wetting their bristles are: wetting the bristles softens them slightly, which many find more comfortable for their teeth and gums. It can also rinse any debris off prior to applying the paste. Wetting also helps spread the toothpaste evenly when you start brushing, both across the bristles and the teeth. Soft bristles are generally recommended by dentists because they're less likely to cause gum recession or enamel wear, so if you're using a toothbrush with stiff bristles, wetting them might help reduce this risk of irritation. And then there is the sensory preference. Some people just don't like the feel of dry bristles in their mouth. I have to say personally, I find dry bristles feel less comfortable for the first few seconds of brushing, but they soon soften as they get wet from the paste and my saliva. I can't say it is a deal breaker, but something I have noticed when I don't wet my brush. I do generally find most paste do spread better with that extra bit of moisture. The case for dry bristles. Those who prefer to stay dry argue that wetting the toothbrush isn't necessary and might even dilute the toothpaste, and in many cases can make the paste foam quicker, causing you or I to spit it out sooner. Many also say that using dry bristles could create more friction, which some believe improves plaque removal. I think it is fair to argue that adding water can dilute the toothpaste and its effectiveness, particularly when you have active ingredients like fluoride, which strengthens enamel and protects against cavities. If you add water, you might weaken the concentration of these ingredients. But toothpaste is mainly made up of water. The exact percentage varies, but 60 to 80% isn't uncommon. This is in part why toothpaste tablets exist. They do away with the water to reduce the shipping size and weight. And if you don't put water on your bristles, you are putting the paste into your mouth, which is wet, so arguably dilutes the concentration anyway. The mechanical action of brushing the teeth is what disrupts the harmful plaque, so friction definitely has a place, but there's a severe lack of scientific evidence to say dry bristles improve plaque removal. What do dentists say? When I've spoken to dentists and dental hygienists, most of them agree it doesn't really matter if you wet your toothbrush or not. What does matter is your brushing technique, your brushing time. As long as you're following these basics, wet or dry bristles won't make a big difference. But that said, some dental professionals do certainly seem to be firmly on one side of the argument than the other, yet few in my experience can cite science to back up their claims. There is no specific guidance on this matter from the American Dental Association or the UK's NHS or Oral Health Foundation. That said, reports suggest that Professor Damien Walmsley, a scientific advisor to the British Dental Association, has said a dry brush will increase friction with the bristles, while a wet toothbrush adds moisture and for most people makes the experience more pleasant. Whatever your preference, what's essential is that the teeth should be brushed twice a day for at least 2 minutes with a fluoride toothpaste, including last thing at night. What does the science say? From all the arguments I have seen on or offline, none reference any proper scientific studies that look at or even reference loosely data to confirm one way or another is right or wrong. I've tried looking at the main sources I would consider might shed some light on the matter, but with no success. Without any proper data, the arguments for either are somewhat flawed and reaffirm, like many things in life, it is personal preference. Heck, even the debate between oscillating, rotating and sonic toothbrushes doesn't have a clear-cut answer, and that's a subject where there is likely far more funds available to finance research. Not much hope of anyone really stumping up the cash to pay to investigate wet or dry bristles. Final thoughts and recommendations. So, should you wet your toothbrush before brushing? If you like soft bristles, wet it. If you want a bit more friction, go dry. Ultimately, it's personal preference, and as long as you are brushing properly and using a fluoride toothpaste, you're doing what matters most for your oral health.